When you look at the literature, we tend to say that there's 4 different types of wealth. And so the first is financial wealth. And what we often forget, because we're having this great debate about student loan debt, about income potential as physios. But for me, when I look at the data, the typical Black household, the median household income is $54,000. But then if you look at a new grad coming out of PT school, you're probably gonna make somewhere between $80,000 to $90,000 in your first year of practice. So physical therapy or physiotherapy is an opportunity for you to generate wealth, for you to address this generational curse, right, of Black people having less income, less abilities to transmit wealth across generations. So the first is financial. The second thing is when we think about health wealth, right? And so physical therapists, although yes, we are in that space of rehabilitation, but there are so many other ways in which we can promote health, right? The prevention of disease and disability, the prolonging of life. We really have not maximized our potential in the healthcare ecosystem. And then the next type of wealth is social wealth, right? That ability to create community. I think we forget about the fact that when you go through PT school, when you graduate, when you find your tribe to grow as a physical therapist, that expands your community. It expands your social capital. And the last thing is time wealth, right? So you are going to be a doctor of physical therapy, but you're going to have a different autonomy and use of your time than other types of doctors. And so I think as physical therapists, we need to talk about how we generate wealth across all these domains. We are so much more than just the exercises and the things that we see in clinic. I did not choose PT. PT chose me. I was in school for computer information science. I was one of those people that I was like, I can tolerate humans, but I don't particularly like humans. And I also had 2 kids in high school. Most people don't know that I had a kid in the 10th grade, a kid in the 12th grade. And like most really smart Black students, I was on this one-way track to medical school. And so after my first child, my guidance counselor at school said, you might still be able to go to med school. You might still be able to become a doctor. After my second child, she said, McDonald's has a really great managerial program so that way you and your babies won't have to be on welfare. And so it was my mother, a Southern woman who did not go to college, who said, that is not your story. She said, you and your babies are gonna go to college. And so she made me take the ACT. I did not want to take it. I was able to get a high enough score to be able to get a full ride scholarship. And so myself and my 2 daughters, a 1-year-old and a 2-year-old, we went to college. And I remember being in my sophomore year and was walking across campus headed to econ class and got approached by a man who I would later find out was one of the administrators at the college, who said, young lady, have you ever thought about being a physical therapist? And I thought he was trying to hit on me, right? And I'm like, I don't have time for that. I'm on my way to class, I'm on a mission, and I'm not into old men. So I was like, no. And he was like, no, I'm very serious. He said, we've been tracking you. We know that you have a high enough GPA that you actually could go through the application process and be a successful applicant. And so my mother, who has always been my role model, has taught me to be a little kamikaze, right? And so I could hear my mom going, why not? And so he said, would you be willing to shadow? And so that was the beginning of my PT story. I tell people all the time, PT chose me. I did not choose it. And it has been an amazing ride, and I've been able to meet and also nurture so many young PTs and leaders such as you and so many others. I'm just so thrilled to see where the profession is going.